Okay, so what we have here is a young man who is 15 years old, and as we look at this structure, we're going to point out some of the deviations that we see within his body. If we look at his right side compared to his left side, we can see that the young man has a very significant amount of scoliosing. His right ASIS is much higher than his left. So again, if we use this is why we have the grid, we can see our vertical lines and our horizontal lines. And if we were to draw a horizontal line across his ASIS, we can see that there's a pretty significant between the two in their horizontality. Look at the shape of his torso and his trunk between the arm and the trunk. This left side has a lot of space as the arm is hanging with the line of gravity, but this right side is very compressed. What's been interesting is that this young man, his clavicles are rounded a little bit, but not one shoulder is that much higher than the other. His right hip is much higher and the left shoulder is a little bit higher. So this was before the first session when I worked with him last week. We're going to come to the next slide, which is after the second session. So this is before we've done any work with him. And we're going to come to the next picture. And I know there's going to be a little bit of lag time for you guys, so I'm going to wait up just a little bit so that catches up. So now as we're into the second picture, compared to the first, you can see the horizontality of the pelvis is much more level. The right hip is nowhere nearly as high as his left hip. We can see the shoulders. That left shoulder still wants to be a little bit high, but look at how much closer his left arm is to his left side compared to that first picture. And again, and that S-shaping or the scoliosing of his spine, because remember, everything's connected. So as we're looking at this young man's structure, the front is just the front of the back. The back is just the back of the front. But so few practitioners think in that concept. They just get connected and they get their tunnel vision on and they think about, okay, I'm going to work and work and work the shoulder where they're experiencing the pain, but that's not necessarily where the problem is from. Now, what's interesting with what I did with this young man was we did just a little bit of work on his spine through here, and we actually spent a huge amount of time working through his legs. If we go back to this first picture, we can see that that pelvis is crooked. And where do you think he's experiencing the most amount of pain? He's experiencing the most amount of pain in his low back and up through his mid back. But the work was applied to his legs and his feet because this left arch through here was completely collapsed, falling into the ground, which was causing that left hip to fall down, and then the body was compensating so that right side was contracting even more. So as we come back to the second picture, we can see now that the legs are much more even to each other and those hips are much more level. So again, I spent more time working on his legs to start to address the low back than actually working on the low back itself. So there's an example of where it is. It isn't. His pain was in his low and mid back, but the problem is not only coming from where he's experiencing his pain. We're going to come to the picture from his side. So again, because of the scoliosing, we can see a significant amount of curve in his low back. I should wait just a second. I know that's a little slow for you guys in its delay. So here, as we look at his low back, we can see there's a significant amount of lordosing happening. We can also see the right side of his low back. If we're looking at a patient from the side view, I shouldn't be able to see their right side if their left side is presented to me. Another thing that we're going to see in just a second is the rounding of his abdomen. He's a basketball player. He plays 4 or 5 days a week for 2 hours a day, so he's in great shape, working on becoming a basketball star. He's very phenomenal. But as we transition to after our second treatment, look at the change, as it's going to come up in just a second. Look at the change of his abdomen. As we look at his abdomen, look at how much more flat that is. As we come to his low back, now we can see that we have lesser of a lordotic curve, and I can't see his right side at all. I just see much more of a straight shot through, which is how that picture should be. So if we're going to go back to the first session, we can see again, look at that elbow covering most of the back. much more lordotic curve through here. That pelvis is fairly severely anteriorly tilted, and then the abdomen is rounded. Because that lordotic curve, what that does is that starts to push the spine into the body, so the organs have to round forward and out because there's no room for them. As that spine starts to come out of the body, all of a sudden, as we come back to our second session, we can see his abdomen will flatten out as that lumbar curve is less in its severity. As we come to the next picture, sorry, some technical difficulties here. As we come to the next picture, this is a gentleman who, if we could guess where his pain was, what do you think you would all say? We would say a significant amount of pain. Yep, you're right, in the cervical spine. You can see how rounded his shoulders are. Dowager's hump or hunchback is what our patients oftentimes call it. A very, very rounded thoracic spine. And so he was seeing a therapist. He was seeing massage therapists, chiropractic care consistently, and it would feel better for a day or two, but he would be right back to square one. So we can see if we were to look at our vertical line, we start from the ground and we work our way up. Here's our malleoli. We come and we see the center of the knee is forward, the hip is forward, the shoulder is forward, and the ear is even more forward over the shoulder. So this poor guy's head is over his toes, which are not designed to support the weight of the body. So again, look at how severe and significant this kyphosing is, and then the contracture through his cervical spine, severe migraines, debilitating pain where he was averaging a day a week out of work, which was putting his job in jeopardy, because let's face it, most people in America can't miss too much work without being replaced. So we're going to go to after our 10th session, and we're going to see a very significant change in his overall everything. So as we come to his head, we can see that his head is much more over the shoulders are over the hips are over the knees, and the knees are over the ankles. So what this does is this allows the body to be more soft and neutral as opposed to being so contracted. Because again, as he was very far forward, all of that tissue on the back side of his body, all of that posterior musculature and fascia was getting stretched out, and then it was holding on for dear life. And then the front tissue was shortening up. So in this whole process that we worked with this gentleman, each session we only spent about 5 to 10 minutes working on his back, and rest of the time was spent working on the anterior surface of his body. Now, I'm not saying that you have to do that, because again, your treatment protocols will be a little bit different based on your specialties, but with the Rolf method of structural integration, what Ida discovered was that the work doesn't have to be, and it shouldn't be, focused on where the cables are too long. Okay. All right, so now as we're to the next sets of slides, we're going to look at this gal in the gray. She is a dystonic patient. Dystonia is a neurological disorder in which the message is into the brain, so what the body is telling the brain is not correct. And then the brain then responds with not sure what it's supposed to do. It causes significant contractures and tremoring. And shaking. So many patients who have dystonia are actually diagnosed with Parkinson's because they look very similar to each other. So we can see in this first picture, if we look at her waistline through here, we can see her left trunk is very contracted, and it's actually pulling the shoulders over to her left side. So the body's compensation to that is coming up into the right cervical spine. We can see that her right head is very severely tilted. Now, this was not her just standing in that position, making herself be there. It was she had no control over this. The dystonia was contracting and causing the muscles to go into spasm and severe hypertonicity to pull her out of where she needed to be. The young lady on the left-hand side or on the right-hand side of the screen with the purple top, we can see as we look at the shoulders that that left shoulder is much higher than the right. But again, where is that deviation coming from? Her pain, if you guess, is probably in the cervical spine, which was absolutely true. But what we found was that she had a huge amount of contracture through her right torso. So this was pulling the right shoulder down, and it wasn't so much what was going on her left side, which is where all of the other therapists were focusing. So again, if we look at the short cables and decide where try to figure out and do the detective work of where the pain is coming from. Let's say you have someone like this that comes into your office and you work the first session in her neck, and she comes back the next week and there's no change. Don't just go right back to that same area because you were already there and it didn't really make much change. Look at the horizontals and verticals and maybe try another area. So if the shoulders are low on one side or high on one side, is it being pulled up or is it being pulled down? So something to think about. As we come to the next slide, here is another young woman. Her reported symptoms were severe neck pain and migraines, severe shoulder pain, as well as severe low back pain and knee pain. This young woman was 19 years old when I was working with her and was at a point to where she was working on filing disability claims because her pain was so severe that it was hard for her to go to work for even 2 or 3 hours at a time. So here we can see this neck and shoulders. Again, that left shoulder is elevated. The feet and the ankles, if we compare them from the first picture to the second picture, we can see that they're very different. The clavicles are much more horizontal. If you look at her head in relationship to the picture in this first picture to the second, you can see the shape of her neck is very different. But again, we spent very little time working on her back and more time working on the front of her body. Because again, the cables on the front side were shortened and compressed down, and the cables on the back side were too elongated. So again, where her pain is isn't necessarily where the problems are at. As we come to our next picture here, we're going to see that this was a 7-year-old boy who was participating in martial arts and soccer. His knee pain was so severe that he was at a point to where he was having to quit his sports because he couldn't even be in practice or in his training sessions at the karate studio for more than 10-15 minutes at a time without the pain being very excruciating. So as we come into looking at, this is the first session that we worked with him, the beginning, this first picture with the green shirt, we can see that his feet have completely fallen and collapsed. There's no support within the arches. We can see the knees are very knock-kneed, and there's a lot of stress and pain going on in this picture. This picture was taken, we did 5 sessions with him at about 15-20 minutes at a time. But the key was we didn't spend the whole time working his feet. We spent the most amount of time working his lower legs because the foot position is completely determined by the muscles of the lower leg. Just like if you move your hand, moving your fingers, opening and closing your hand isn't a result of the muscles in the hand, it's a result of the muscles in the forearm and what's going on here. So as we start to organize the muscles in the leg, all of a sudden we can start to see a significant change in his feet. And then as we come to this picture was the little boy 9 months later with no more work. What we did was after we worked with him, 3 or 4 or 5 sessions, each session, session 3, session 4, session 5, 3rd, 4th, 5th treatment, we started working with him on how he was supposed to walk, how he was supposed to stand, and what that did over the next 8 or 9 months was allowed his legs to continue to change to where now we have much straighter legs, we have the feet that have arches in them, and his pain was completely gone, 100% resolved, and he was at a point where he was having to quit his athletics. This is one of my most favorite pictures. This is going to be explaining so much low back pain. So as we're in this next picture, and hopefully your screens are catching up, we look at the picture on the left-hand side of the screen. And if we look at her waistline, we can see her waistline is almost a 45-degree angle. What that means is that there is a massive amount of compression in her lumbar spine, severe low back pain. There was so much deviation in her structure here that she was actually having infertility issues. Her cycle was all over the place because the internal pieces and parts, her reproductive system, her digestive system, couldn't work properly because of the severity of the deviation within her pelvis. So as we come up to the head and the neck, because everything is connected, when that waistline and that pelvis is not level or straight, the head and the neck then start becoming compressed, and they're compensating because everything's connected. So as we come to this picture on the right, again, same thing. We spent very little time working her overall back, and we spent more time working the front side of her body. So we can see the pelvis is much more level. We can see that low back has much more space. And look at how different her head and neck are versus this first picture where everything is squished. Look at the waistline, how much more flat the abdomen is. Look at how rounded the abdomen is here. So where do we think this problem is coming from? Again, her pain was severe low back pain and severe neck pain, cervical pain, migraines, as well as thoracic outlet syndrome, where she was having tingling and numbness. She was dropping things because there was so much compression through her cervical spine and thoracic spine. So remember what we talked about, the hamstrings being too long? If we connect the hamstrings here and we connect the quads here, we can see the quads are very contracted and shortened, and these hamstrings are so stretched out that they just can't hold on anymore. But she was also having a significant hamstring pain as well. And so as we started working with her, each session we were spending more time on the front than what we were on the back, and we were working the backside, but in about a 2-to-1 ratio. And then all of a sudden, look at this immense amount of change with her structure in this second picture versus the first picture. So again, where it is, it isn't. And oftentimes where the patient is telling you their pain is, that's the symptom of the body not working properly, and that's where it's expressing itself, but that's not always where the problem was. So we worked more on her quads and more on the front side of her body than we did on the back to produce these significant changes. And again, no discrimination on the kind of therapy you do. You can do energy work, you can do Swedish massage, you can do trigger point, and if you spend more time on the shortened cables than on the long cables, you're going to get more bang for the buck. We're traveling nationally sharing this work that we're doing. This is just a tiny, tiny piece. It's not even a tip of the iceberg on the information that we have in regards to being able to treat significant, severe, long-term issues. Now, the beautiful thing is that maybe your practice doesn't consist of chronic pain. So if this work works so well for chronic pain patients and people who are having a hard time, imagine what it will do for people who are more healthy and are looking for just overall improvement, even if they're not experiencing pain. Again, we work with so many professional athletes, young kids, we work with people who are older. It doesn't matter if they're severe or if they're mild in their discomfort. What we know is that starting to apply these concepts, it produces such a massive amount of change in such a short time period that it's pretty remarkable. Again, we're dealing with people who've been to the worst of the worst in regards to how bad they're hurting. So we're traveling all over the country. Our website is going to have a list of the upcoming classes. There's going to be a lot more classes coming up. Not all of them are on the website, as we're still getting a lot of requests to go all over the nation and actually internationally as well. One of the things that we're offering you guys for you spending your time with us this Friday evening is that if you sign up for a class, one, we have an early bird registration special where if you sign up for the class a month before the start date, you get a $50 discount. And then we're also going to offer you, as a thank you for spending your evening with us, another $25 discount if you sign up by Sunday evening at 12 p.m. Which is going to be a $75 total discount in regards to the upcoming classes. There's a great amount of information in regards to what we do teach and what our specialty is. If you want to shoot me an email and ask me any specific questions in regards to patients and conditions that you're trying to address and treat, and maybe they've been a little tricky, I'd love to do that. This is my passion. My passion is to help people. My dream is to be able to teach people to help more people. And again, thank you very much for your time tonight. The code to be able, it's webinar, so if you go to the website and you click on register and you type in promotional code webinar, that will give you that $25 discount for spending your guys' time with us this evening as a special thank you. We're about 6 o'clock. We're at our hour. I hope you guys have a wonderful night. Have a great weekend. And thank you very much for spending your evening with me. If you have any questions, give us a buzz. Thank you so much.